Hello everyone, welcome to another episode of Gorgeously Bold Moments. Guys, I'm very excited today. Today we are talking about plastic surgery. We are talking about liposuction. I know a lot of women are going to be tuned in. Stay tuned to hear more. We're joined by Lillian. Guys, welcome. I told you, we're talking liposuction, we're talking reconstructing the body, we're talking everything beautiful about us as women, the things that we do. Not only women, I know also a lot of men that would consider liposuction, that would consider, should I call it fixing, or whatever that works for you. If you want to adjust, if you want to reconstruct, if you want to cut certain things out of your body, we are here to talk. Lillian, thank you so much, my darling. Thank you so much. Guys, let me tell you, Lillian is also one of our beautiful clients. Remember that the Gorgeously Bold Moment is created for and by our clients. It's always about Gorgeously Bold clients and hoping to inspire you, the ones that have not yet interacted with us. We hope that we inspire you enough to come and join the Gorgeously Bold family. So, Lillian, I remember, was it this year or was it last year when you and I we had a conversation about the procedure that you had?
This year.
It was this year.
Yeah.
And I said, the first thing that I said when I looked at you, like, did you lose weight? You look absolutely amazing. What have you done? And she said to me, I have done liposuction. I'm like, I was so excited that we have to have her on the Gorgeously Bold Moments. So the procedure, that's something that I read about. We see it a lot on TV, especially America, Beverly Hills, all of that. So tell us about the procedure. What inspired you? What made you to actually think about it, and the process of considering it up until to the day that you actually had it done? Okay. How was that?
This process has been a journey.
Yeah.
I'll tell you, it's been such a long journey. But from when I was little, I've never been small.
Yeah.
I have never had a small waist.
Me neither.
I have never had a flat stomach.
Yeah.
For as long as I can remember, but it hit me more in my 30s.
Yeah.
Because I was running.
Yeah.
I was
yes,
going
you're
to
a
the
runner.
gym.
You're a runner. Yes.
I was doing, but the tummy always stayed there. All the sit-ups, all the push-ups, all the planks.
Yeah.
My tummy never went.
Yeah.
And so after I got my second baby, and I got my second child when I was just about to turn 40, and prior to getting my second baby, I'd had a traumatic event with a baby that I'd lost.
Oh yes. Yeah,
so getting into my second baby, I was turning 40, and it was time to make life decisions. And I didn't like my body, and I'm like, this body, I run, I do all this, like gym. I still have a belly.
Yeah.
People ask, why are you running if you're pregnant?
And why not?
Yeah. And you're always tying something around your waist to hide your tummy, and just don't feel comfortable.
Yeah.
So I started talking to my husband about it at 40, and my baby was little. So I went to see, I got a recommendation from a good doctor friend of mine to go see a doctor in Sunninghill Hospital. And I went and I talked to him. First thing he says is, you need to lose weight.
And I've been trying to lose weight.
And I'm like, and then immediately I feel judged.
Yeah.
Because this man is telling me I have no control. I can't control what I'm eating.
And to you, that's not true. You
and
know
that's not true.
Yeah.
I have always been conscious of how I looked. I was not skinny, but I was not fat either.
You knew you wanted to adjust your body somewhere.
Exactly.
Yeah.
So this man tells me, you need to go lose weight, lose 10% of your body weight, then come.
Easier said than done, right?
And I felt so judged.
Yeah.
And I was like, what a waste of my consultation fee. It was 750 rand.
I would also feel like that. Like, I came here for...
And that was in 2015.
Yeah.
And I felt so judged.
Yeah.
So I left there and I said, okay, fine. I'm going to lose this 10% of body weight. At the time, I needed to lose about 8
Did you even have
kilos.
a plan of how you're going to start losing
I joined the gym.
Yeah.
I joined Dream Body Fitness. I started working out.
Yeah.
And I hate gyms. Anybody who knows me knows I hate gyms. I like being out in the open running. So at 41, I started doing taekwondo.
Yeah.
Martial
But
arts.
was there, from the time that you left the doctor's office now to follow his advice, did you see any change?
No, because I was doing what I was doing. I was watching what I was eating. And the tummy was still there. Nice and wobbly.
It's not easy.
It's not easy.
It's not easy.
So I joined the gym. Then I felt, no, I need to run.
Yeah.
So I asked the gym, I need a running coach. I need a running coach because I want to run more seriously. And that's the time I decided I want to run a marathon.
Are you kidding me?
I'd never run a marathon
Okay.
before. I don't even know how, I didn't know how far it was to run a marathon.
What is the longest that you have
I had done 10 kilometers only.
Okay.
A marathon is 42.2.
Oh, Lord, have mercy on
Four
my
times.
soul.
4 times. So
Yeah.
I thought, so when I went to see this running coach and I told him I
Yeah.
want to run and he told me what needs to be done and we started training and there's a lot of training. But in 6.5 months, he got me from 0 to running a marathon. I ran Soweto Marathon, I finished. Then I got addicted to running and I started running more often. But the tummy's still there.
It's
I
just not
lost
going
weight.
into
The
it.
tummy's still there. You know, as women, we've got the
Yes.
thighs that touch.
Eh,
The gap
Tell me
even
about
came.
it.
I had a gap in my thighs.
Yeah.
That's how much weight I lost.
yeah.
But the tummy was still there.
And you know, a lot of women want to have that gap thigh, right?
I had the gap in my...
Yeah.
That's how much I was running.
Yeah.
But the tummy was there. So at 42, I ran my first marathon. 43,
Yeah.
44. Meanwhile, I'm still thinking, this tummy, something is
There
wrong.
must be something.
You know, something
yeah.
else is going
Everything
on.
else is falling off, but
Right.
why is it
So you
still
start
not?
reading and you find that some women have got this muscle separation.
Uh-huh.
I don't know where mine came from because I don't remember ever having a belly. Some women, it comes from having babies and the muscles separate. And then that causes you to have the belly and all the sit-ups in the world will not make it go. The muscles have to be brought back together.
But how? Without...
Exactly. You can't sit them out. You can't
Sure.
exercise them out. So when I started looking to that, I'm like, okay, then I need to do a tummy tuck. But
So the idea came
yeah.
that...
No, the tummy tuck had already been thought about
Yeah.
with the previous doctor.
Oh, yes,
remember?
yes.
But the running and all that, then I realized all the weight loss
Yeah.
will not do it. Meanwhile, this doctor hadn't told me that. He hadn't felt the gap that there was. So all the running, all that, and I keep running and I keep doing all these necessary things and dieting, and I've done crazy diets. and the stomach never went.
Yeah.
So eventually, during lockdown, I was like, this would be a nice time to do it. It's quiet.
Yes, you're home.
You're
and-
home, there's
yeah.
no distractions, everybody's home. And
Yeah.
so I talked to a friend of mine and I told her, because she's had work done.
Yeah.
So I asked her, listen, I'm looking to get work done. And she said, oh, I've got a friend of mine who had work done
Okay.
by this doctor. I said, okay, give me the number. So she calls her friend, gets the number for me. That was in end of July,
Okay, last year. This year.
early August,
sorry,
last year,
yeah,
2020.
Yeah.
So I called the doctor in August and I get an appointment of October. That's how busy he is.
Okay.
So I'm like, fine, gives me time.
But
to-
what is the waiting period usually? Like if it's from August that you booked and you got...
He's a
October.
busy guy.
Yeah.
He's a busy guy, so your first consultation,
Yeah.
from the time you have your first consultation to when he does the procedure is up to you.
Okay.
Because it's you thinking about it, you paying the money, you coming correct with your head that you're going to do this. It's major surgery. But then this friend called and said, no, he's my friend. He can't give you October. So she called him and he said, okay, fine. Tell her to come on Friday. She'll be the last patient for the day
Yeah.
as I'm closing. So I go and immediately there's a rapport. He's a black doctor.
Yeah.
Immediately you connect. I had never
Can you
known
mention the name of the doctor?
Dr. Monaisa.
Dr. Monaisa.
Brian Monaisa in Krugersdorp.
Okay.
Now, I had never talked to a black plastic surgeon before. The two I had seen previously were white. So immediately there's a connection. And you feel this person friendly, you feel
Yeah.
comfortable. So he goes in, he tells you take your clothes off, you lie down,
Yeah.
and he does his thing, and it's like, okay, there's a
There's
gap
those gaps,
there.
yeah.
Yes.
Is it a lot of gaps or just one gap?
It's
or-
one gap.
Okay.
Because your abs are apart.
Okay.
Yeah. So at first I had only wanted liposuction. Suck out the fat. And he said, first of all, there's a gap there. So we can suck out the fat, but you'll have loose skin.
So we have to close the...
So we need to fix the muscle, bring it together, and we need to give you, let's just do a tummy tuck. Because if you do liposuction, there'll be loose skin. 6 months later, you'll want that loose skin taken out. So let's just take it out. So that's how I got to talking to Dr. Monaisa.
Okay, so what you did was the removing of the fat.
We did a tummy tuck, and a
Yeah.
tummy tuck with liposuction.
Okay.
So we liposuctioned my back, we liposuctioned my love handles, we liposuctioned my lower part of my back.
That's why you're able to see.
That's why now I have a behind. And so that's so he talks to you about it. He told me what we're gonna do, and of course you're thinking, this is major surgery. I'll be under for 4.5 hours.
Yeah, 4.5 hours.
I've never been under anesthesia for that long.
Yeah.
So immediately you start thinking, oh, what could go wrong? So I told him, listen.
But when you're asking things like that, what could go wrong?
We're talking, and I told him, listen, I'm okay with doing it because I've thought about it for a long time, but I don't want to die.
Yes.
I've got small kids.
I just came here to lose weight and then go home. I don't want to die.
He's like, you're not going to die.
Yeah.
I've never lost a patient.
Oh, he's not.
So it's like,
ladies, guys,
listen. So there's that, again, you're talking to him. And then I told him about my experience with the other doctors. And the one thing he told me that made me feel comfortable, he said, I'm not here to judge you. I'm not here to judge you. I will work with your body. And
I mean, body sensitivity, these are sensitive issues.
Yes.
So, yeah.
Because I told him, should I lose the weight first? He said, I'll work with your body. Bearing in mind that, of course, the bigger you are, you might not see the results as well as you want to, because there's only so much fat
that they can remove at a time.
He can take out at a time.
Yeah.
So, of course, the ideal is to come when you're at your perfect weight. But if you want it done, my job is not to judge why you want it done.
So, but in your case, when you went in to remove the fat that you wanted to, did you remove it, all of it, the one that you wanted, or not?
He took out what he could.
What he could.
Medically, without causing trouble.
Okay.
So, a lot of times they can take up to 5 kilos.
Okay.
Maximum 6 kilos of fat.
Yeah.
That's a lot of fat.
That is.
But there's still some things we will go back later and fix, which the more I think about it, I'm like, I'm okay. I think I might not do it. But because it's now...
You look amazing.
It is all...
Amazing. I'm going to post a picture of one of the dresses that she got recently. She looks absolutely amazing.
Yeah, because it's all vanity after that.
Yeah.
Anything more you want is just...
So now, like, talk us through the whole experience. So now you've booked yourself into the hospital. Now you're going. What's going on through your mind? Like, okay, fine, you know that we've already established that you don't want to die. I wouldn't want you to die. I'm sure your husband wouldn't.
No.
But what's going on in your mind at the time?
You're Googling. You're Googling all these things of tummy tucks, things that could go wrong. What could go wrong?
What could go wrong? What are some of the common things
tummy
that could
tuck is major
go?
surgery. You get cut from hip to hip.
Sure.
Then he lifts up that skin to fix the muscles. So he stitches those muscles together.
And then the organs and...
Exactly. That's why he can only liposuction. You know the liposuction, they use this thing.
Yes, absolutely. Yes,
so there's only so much you can do in there without... You might cause trauma and healing.
There's one video... okay, I like TikTok a lot. Yeah. There's this surgeon who performs his surgeries on the patients while they are awake.
Okay.
Like literally he opens the stomachs and does whatever he does. And the people are awake, you know. Okay. But obviously I'm sure there is no sensitivity, whatever it is that he does, you know, anesthesia and all. But I'm just thinking that, how were you awake or
no,
were
no,
you
I was totally under.
Yeah.
Which was probably okay, you know. But it's a long time, and my poor husband, mine actually took 5 hours versus the 4.5 he had said. So, of course, my husband later, I asked him, he said he was nervous. He's never had his wife be under for 5 hours. So he is pacing up and down. They had to come out and tell him, no, everything is fine.
And you still stay at the hospital afterwards? How long?
2 nights.
The process? You stay 2 nights?
Yes.
And then the healing process thereafter? After being released?
That's the first week.
Yeah.
Was terrible.
I can imagine.
You're swollen, first of all. So you don't even see the results of this work that's been done. But you are swollen and you're in pain.
Sure.
Because once the pain medication, you get medication to go home, but it's painful. They've worked all this.
I can imagine.
This entire section is being worked on. Your back. What I tell people is, it's almost like someone taking a cheese grater.
Huh?
That is how you feel. Have you ever fallen on the road and scraped?
Yeah.
You know that feeling?
Yeah.
Yes,
now on your back.
And your entire back.
And
on your front.
And which side do you sleep on? Like the left or right? Because you
don't sleep. You sleep in a reclined position.
Oh, God.
I luckily had a recliner at home. But you've been sewn so tight. So you can't stand straight.
Yeah.
So you're bent over this way.
Eish.
Nearly half bent over for about 3 weeks. You cannot stand straight. So your back is killing you.
But it's all worth it at the end, right?
Yes.
I mean, you look amazing.
Thank you.
You look absolutely amazing.
It's not easy surgery. I tell people, if you don't have good support, just wait. Because my husband had to help me go to the toilet and then slowly sit down. And my kids are watching all this as you're suffering and wondering. My little one was like, why do you have to do this?
So after 3 weeks, you're able to sort of like move around the house.
After
Can you
3
drive
weeks,
then?
No. It's recommended 6 weeks because you're not upright.
Yeah.
You're not totally upright, so your reaction time in an accident might not be good and all that and all that. So it's not recommended too. I'm a stubborn patient.
Yeah.
In about 5 weeks, if you ever talk to he'll tell you she's a very stubborn. In about 5 weeks, I was ready to start running again.
Yeah.
And he struggled to keep me not doing it.
Yeah.
So recovery is terrible. You go home with tubes that are attached so that the fluid comes out. And it's not nice.
Sure.
But a week later, you start to feel better.
Yeah.
And you can start seeing the swelling going down. And you're seeing your waist coming in. I still get amazed when I go stand in front of my bathroom mirror. This is me.
Yeah.
There's a waist.
Yeah.
Is this my shape?
Yeah.
Really? Because remember, I've never had a flat.
Sure.
So I stand there, I'm like...
And you probably wondered, why didn't I do this sooner? Has it ever crossed your mind?
I believe in timing.
Yeah.
There's a time for everything. Had I done it sooner, maybe I wasn't in the right mindset. Because you have to be ready. It's painful. It's expensive. It is very expensive. You have to be ready. So maybe at that time, yes, I wanted the flat stomach, but maybe I was not emotionally, mentally ready.
Because you're changing some parts of your body. Yeah,
and that 5 years I was saving money for it. Because remember, with the other doctors, I had gotten an estimate of the cost.
So you were gearing yourself up.
I was gearing myself up to, and with each year, of course, there's inflation. So the surgery is getting expensive every year.
Yeah.
But I was not at the right mind at that time. It came at the right time. It came during COVID when it was quiet. You can do it. There's no, where has this one gone? We don't see her anymore. Because for 6 weeks, you're just...
You know, the one thing that I'm really grateful for, I'm so grateful for the fact that you openly talk about it. And, you know, because what we see, for instance, if you look at the social media, the things beauty, how it's defined, especially by the so-called celebrities and whether influencers, whatnot, you know, the small waist and what, and then there is a mark that they put there, and you must exercise. It's all about exercise. While exercise is all good and well, but certain things, like you said, they do not get fixed by exercising. And I feel that sometimes we, especially the young ones, they get very misled about, you know, the body features, you know, and by exercising, doing whatever, it just that sometimes doesn't really help. Yes. Am I correct?
It's good for your health, obviously.
Yes, it's good for your health, but we don't look like this because of exercises. Perhaps let me not generalize and say we don't. Maybe there are some that are blessed with bodies that don't need to be reconstructed in any way or form. But the truth is, largely a lot of us women, beautiful women, they would have had one work done over here. Let's openly talk about it. Let it not be a secret.
I honestly see no shame in it.
Yeah.
It is not a cop-out. And it's not easy. Because I think a lot of misconception is that you're taking a shortcut.
Yeah.
There's no, at least for me, it wasn't a shortcut. There was a 5-year process. I ran 4 marathons. In that period, I've run 4 marathons. I've attempted comrades. I didn't finish. I've run 2 oceans.
Well done.
I've run 48 kilometers Irene. I've run 50 kilometers Benoni.
Wow.
I have run.
Yeah.
I didn't.
You were dedicated, committed to seeing the change.
Yes. So a lot of people think it's a shortcut, and you took the easy way out. I can tell you, the healing is there's no easy way.
And also the time that you spent saving, it's really not a shortcut. It was over a period of years.
It's a process, and until now, many months later, you still feel it's not quite... Remember, you've been cut so much, so everything is still connecting back. So there are times you feel a bit of... for women who've had C-sections. Yeah,
guys, stay with us.
There's a numbness you feel there.
With the C-section.
Yes. Now imagine feeling it the entire waist. The C-section is about that. Now you've got a whole waist to waist. You've got this scar forever. forever.
Yeah.
And it's, again, I go back to talking about having, like, I used the black doctor, and I was very comfortable.
Yes, and I want us to talk about
And there's a
about the
connection,
doctor.
because with the doctor, he was easy to talk to and would laugh about it. I'm like, at this rate, my ancestors will never recognize me. And we laugh about, but you see, he gets it.
As for, I like that my ancestors will never be able to recognize me.
What did you do here? So, but he gets it.
Yeah.
So it's not someone who would look at you like ancestors.
Yeah.
What are you talking? You know what I mean?
Yeah.
White people don't get it,
Yeah.
and there's nothing about. I get along with white people,
Yeah.
and the doctor was referred to is excellent. You look at his portfolio, excellent work.
And when we actually talk about the doctor, I've not really heard of many black plastic surgeons. I mean, the ones we
They're
saw
not
on TV, it's a whole lot of
They're not
white.
many.
And
Apparently, there's about 14.
14
in
in
the
South
country.
Africa?
Yes.
Okay.
There's 14 in South Africa. But I didn't go out to look for a black doctor.
You wanted
I
someone
was,
that's good.
I was referred. So it was part of my trying to find that, right? That person who will make you feel, I need to do this.
Yeah.
So I found this black doctor. And then I went for the surgery. The entire
Staff.
team
Yeah.
in the theater, black people. I have never had a black anesthesiologist.
Yeah. Is it his hospital? Is it a
No,
private
it's
hospital?
no Netcare. It's a Netcare Krugersdorp.
How is it the staff? Everybody's black.
I don't know.
Okay.
I don't know. Maybe it was.
Well, not that there's anything wrong with
There's
it.
nothing
There's
wrong. But
absolutely nothing wrong.
I've had a C-section. I've
Yeah.
had surgeries before.
Yeah.
The
But you
team
always
was
see
not. Yes, it's mixed.
Mixed, yes,
Mm-mm.
yes.
All the nurses who were in there, the others people in there helping, because
Yeah.
I think there's got to be someone to turn you over so he can do your back, and someone.
And the service overall with the
Honestly, I was happy.
Yeah.
I don't like hospitals. Nobody does.
Yeah.
After 2 days, I was ready to go home.
yeah.
But the doctor is involved.
Yeah.
He gives you his number. He's like, call me anytime. And sometimes some things just sound cliche. Just call me. But this doctor, I remember on the day I was being discharged. That Saturday was the Saturday he was going to pay Lobola.
Are you okay?
And he came. He came to discharge before he went.
Ow.
To pay. So he could have easily let someone else discharge
Like
you.
excellence.
Yes. He could have said, you know what?
Yeah.
Let somebody else.
I guess it's refreshing for a change to hear
Yeah.
of black excellence stories. I mean, black excellence delivery services and all, because we don't always hear such great stories
No.
about black service providers or in different sectors.
Yeah.
So to hear you say this, it's
For me, it was
Yeah.
very, because I remember feeling, oh no, hurry up and just go. Don't you need to go and.
yeah,
So no. So he helped me put on, because you have to put
Yeah.
on the binder
yeah,
as you're healing.
yeah,
I helped you get in that, and he was dressed. You could see he's dressed. He's going somewhere.
yeah.
But he diverted and came to do what he needed to do,
Yeah.
and then went back to. So there's that.
Where
comfort.
where is this hospital? Is it
Krugersdorp.
Krugersdorp.
Yes,
Okay.
it's
What's
the
name?
Netcare Pinehaven.
Netcare. Okay.
Yes.
All right.
So I was comfortable. It's something I would do. I would do it again. But at one point I was thinking, what is this? This
Yeah.
pain I've caused myself
Yeah.
and my children watching.
Yeah.
You just suffering. Mommy can't stand up
Yeah.
straight, and mommy can't do anything for us.
Yeah.
It
But
was,
I mean, I think that's what it means, taking care of yourself. Sometimes to take care
Yes,
of yourself, you
yes.
have to just go through some sort of pain in your life, right?
Yeah.
You
but
took
the
care
level of
yourself.
confidence that it gives you.
Yeah.
I can
I
tell
can
you,
imagine.
I'm at another level.
Like you, she came, guys. I'm gonna show you the dress on just tune in. Don't switch off yet. You're gonna see her in the beautiful dress that we made for her. I mean, when you wore that the black dress, your waist, like, and remember, I kept on saying, Lillian, what have you done? You know, I know. I mean, it's not like I haven't seen you like in 10 years, but
No.
really, you know,
I've never been a shy
You
person.
look absolutely
I'm outspoken.
beautiful.
But there's something about just feeling okay. And you're not sucking in. And you're not... Like now when I go running, I'm very confident in the running. I'm very comfortable. I'm putting on whatever t-shirt I want to put on. I'm not putting on a jacket
Yeah.
and covering up.
and there are certain type of clothes that sort of like look good on
Yes,
you now better
yes,
than before.
yes.
You know, we all, of course, this is not body shaming or anything like that.
No,
but I
no.
believe that there are certain clothes that look in, you
Yes,
know,
they sit better.
They
I like
sit
to say they
better.
sit
Yeah, they
better.
sit
They probably
better.
would look okay because you can
Yes.
put some of the things you can
Yeah.
enhance, you can put a belt on and make it enhance what
I
you
mean,
want it to
like,
enhance.
just like with me, I still shrug. I mean, I've got a little bit of a stomach. So you've given me ideas. You know, there are, like for instance, when we have to go out or you know, getting dressed up and everything. I struggle. I would change about 4 or 5 times. Why? Because
you want to find something that.
Yeah, I want to hide this stomach situation. And then my husband will always say, "No, but you look fine." No, I know I don't look fine. If I can
for
see
the men, the men always.
You know, if I can see some other people are gonna see it. So, like you're right. You sort of want clothes to sit in the, and you know how you want your clothes to sit.
Yes.
You know how you want.
And I'm not the kind to wear the body shaping things. Even at my wedding, I didn't go because I remember the aunties came and dressed me up, and when they left, I took it off and took off these tight things. I cannot do tight. I think you even know. I always tell you I don't like tight.
No, but right now you can pull off.
Right now I can pull it off and feel very comfortable. And at my age, everyone says, but I'm close to 50. I just turned 47.
Guys, can you believe it?
So there's this thing, at that age you should be happy, you're comfortable who you are. But I think do what you need to do at whatever age. And be happy. There's a lot of living left.
Yeah.
And I want to enjoy my
you look
living
absolutely
as much
amazing.
as I want. So
I'm so happy that you did this. I'm so happy that you took a stand to, if we were to call it fixed, to do certain things with your, because if you don't do it, nobody else is going to do it for you.
No.
It is your body, and
it's your body.
You must take care of it.
It's safe. There's a lot of course, you must do your homework. You must do your homework. You can't just go to the first doctor that you find. Now, if you feel comfortable with them, go ahead. But I'm happy that I shopped around.
How many doctors did you shop?
Dr. Monaisa was my third.
Okay.
So you're not shopping for price necessarily, but you need to be comfortable. This is a very personal, and then you'll see this doctor for for about 6 months after your surgery. You will see this doctor. So it's someone you need to be very, very comfortable with. And again, it might not turn out exactly like you wanted. Like for me, of course, you've got this image. I'll come out with this little Cinderella waist. It didn't come out that way initially. But the doctor had already said, you know what, if it doesn't, we can still do
But you also
something
still have
else.
to put in some work, am I right? To sort of like take care of...
You need to take care of yourself.
Now,
the thing about liposuction is the fat will not come back.
To the original...
To where it was taken out. You will have to gain a lot of it for it to return.
Whoa.
Now, your fat will go other places.
Okay.
The thing is, if you gain weight, you'll gain weight.
Because I'm thinking, but with what you're saying that the fat will not come back, I'm thinking, okay, so can you go and eat as much as you want? Like, I mean...
You'll grow fat.
Yeah.
But where, like for me, my arms are skinny. So I never gain weight here.
So it would go there.
You might start finding that now your bum gets bigger when you gain weight, or your arms are now getting bigger when you gain weight, or your thighs are getting much bigger.
So it will go to areas
because
where...
previously all my weight went here. Now those fat cells have been removed. So that fat will not come back there the same way. That's the thing about liposuction. You'll start gaining weight other places. If you gain weight, you will gain weight other places. If you eat, you'll gain weight. You could still get the tummy back, but it will never be the same because the fat cells, like he told me, I think he took out about 80% or something like that, if I remember right. So you will not get back the fat the same way.
And also,
so you won't lose your waist unless you really go and become crazy.
But also, why would you want to come back and start eating a lot when you had just gone through what you went through,
and
the pains and the manners?
I honestly wouldn't mind if my legs got a bit fat. I've got skinny legs and I've got skinny arms.
But now these days they can actually inject fat, am I right?
You could. There's a lot of things that they can do.
There's a lot of things
that they can do.
We're living in interesting times.
And you can start getting excited. Like for me, when I went in, I'd wanted my breasts done as well because I thought, again, my sisters are small, so I'd wanted my breasts done. And the doctor was like, no, let's fix your tummy. You might like your breasts better after. Now, he's done the work. I still feel my breasts are... I've met a few friends who said, did you do your breasts as well? And I'm like, no,
I also asked you, remember with the black dress, I also asked you like, but they look...
No, they were not done. They were not done. I still would like them smaller, but I'm okay.
They are perfect.
I'm okay with them
beautiful.
as the way they are. And maybe if I ever get money again, who knows, I might make them smaller. It's expensive. But you have to guard against wanting to do more. Like, what's enough?
So now that you've said something that I actually wanted to ask. That I've heard and I've read somewhere where they say plastic surgery, body reconstruction could become addictive.
It could.
Is that the case?
It could.
And do doctors also have conversations with the patients about that? And how can we prevent it though?
A good doctor will do the analysis. In talking to you, will find out psychologically where are you.
That you have addictive personality.
Because if you have that, then a good doctor should tell you no.
Yeah.
First go deal with those issues and then come.
Yeah.
But even with me, who I thought about this over a long time, you still go like, oh, I could
try something.
I could do it, and my breast could be firmer, and they could stand more. And you need to take your before picture and where you are now, and always compare the two. You're not where you are. And what did you want to do this for in the beginning? What was your goal?
Did you achieve that?
Yes.
And learn to stop at some point.
Exactly. Yeah. And again, good support.
Yeah.
Because my husband will be like, what are you talking about? Before you had this time, now you're sitting here a little bit and you're thinking, oh.
Yeah.
So you need someone to bring you back. Like, come back to earth. Look at your before. I took my before pictures. Look at your after pictures.
There's a huge difference.
There's a big difference. So, what are you trying to...
Be grateful that you achieved.
You've achieved where the rest of it, you can exercise it out.
Yeah.
You can do what you need.
Yeah.
But you have to guard against it. Because I can tell you, you stay on Instagram, even for 10 minutes.
Hey, tell me about it.
You're like, I could.
Yeah.
And I could. And then you still go and try on clothes.
Yeah.
And they're still not perfect.
Yeah.
You know, you're like, I could.
Yeah.
And you can honestly, you can go say, I need that gap in my thighs. And then they'll give you that.
Yeah.
They'll liposuction that, they'll cut out what needs to be cut out.
I think the beauty about this conversation that we and I are having is just the openness about it and just being truthful about it. And guys, let's help people to understand the things that they are wanting to get into. Also, let's not mislead, especially the youngsters, to say we don't do certain things, yet we do. They need to understand the health factors, the risks that come with and of course the exciting things or positive results that we get out of doing body reconstruction. So I'm absolutely grateful. I hope that you guys have learned as much as I did from Lillian. And after this, I know that we're gonna have endless conversation. Me and him are still gonna continue to talk about this. I'm also very curious. I'd like to do something for myself, especially the breast, but I'm still thinking about it.
It is major surgery. I have a friend who has had breasts done, and it's painful. It's painful. It's not a lie.
Can you see how I'm looking at you?
Yes,
I'm just.
It is painful. I won't lie. It is painful. And like the one who had her for a while, she couldn't even just do this. It's painful. It's the truth.
Yeah.
You have to go in with that in mind. But again, get good support structure.
Look at your end goal. What is it that
look at your end goal. Get good support. Get a good doctor. Get a doctor who's supportive. Because you don't want a doctor who thinks you're bugging them when you call them and tell them, "Oh, this is happening. I'm in pain." You don't want a doctor who tells you, You want someone who will tell you, "Okay, come, let's discuss other pain management. Let's discuss." Like for this, I would call him and tell him, "I can't sleep. I'm sleepless. I am." And you want someone who will respond to you. You want someone who, find the right doctor, someone who will work with you, not someone who will cut you and
leave you. Because it's a personal journey, guys. It
is a journey. And that's one thing the doctor said. We're in this journey together. Until the day you say, "I'm done.
I'm healed.
I'm finished. I'm done with you. Goodbye."
Yeah.
It's a journey you're in together. Because whatever he does, you're coming back to him.
Yes.
And he has to, a good doctor. And I believe I found a doctor that we matched. Now, some people don't, and people get, but I know we matched just because of, I think, the personalities.
Yeah. Everything is really energy. Everything is really.
It is.
Any type of service provider. I mean, like for instance, when you also came to us you didn't just come once and we didn't see you again. You kept on coming back. Everything is energy. When you click with people, it's just that.
Over the years, I believe that you have to connect. And when the connection is there, it feels easy.
It's so easy.
You don't feel pressure.
Yes,
you don't feel...
You don't feel afraid to have interactions with people, or even to think about what kind of questions would I ask, will I,
But you do your homework.
Yeah.
Do your homework. Again, it took me 5 years. Some people might take a month. I don't know. But do your homework. Think about it. Look at images. Look at images, realistic images. Don't go look at these skinny women who go and do liposuction.
I'm not skinny.
Exactly. Now don't use those because their results will be very realistic. I was looking for heavy women who are getting lipo. Heavy women, because that will give you a realistic
they before and after.
Yes.
Yeah.
But there's skinny girls out you find on YouTube who are getting tummy tucks. What?
For what?
They look fine.
Yes.
Exactly. So if you're thinking that's what you look like, it's not true. So you do your homework. You Google. I googled black women. I was not even looking. I was specifically
women of your
looking
own kind
for
to see.
How does the scar happen? It's a big scar. This is a scar you will see forever.
Sure. Guys, I am so captivated by Lillian. We can go on and on and on. Lillian, thank you so much for joining us. Guys, thank you so much for tuning in. If you have enjoyed this conversation, please remember to like, remember to subscribe. Let's interact on the comment section. I'll continue to say that those that still send me private messages on WhatsApp, thank you for this. I really appreciate. Remember to hit the bell. Let's continue to be part of the Gorgeously Bold Moment family. Thank you.